a couple of pictures to compare. That's a blood vessel with normal amount of glucose in the blood. That's okay. Over here you can see the excessive blood glucose. And it almost, like you can see all of this sugar in there. And what that does is it actually acts like little shards of glass in your vessels, and it can cause damage along the way, which we'll talk about. So obviously we all have sugar in our blood at all times because we need it. Why do we need it? Yep, you're right, for energy. She said it. She said it quietly, but I could read lips back there. Yeah, so we all need it for sure. We just don't need it in excess. We need it within a range. So when you have diabetes, like what's your name? Like Jennifer was telling us, it's when you have high blood sugar. Okay. So do you guys know about digestion and the whole system already? So where does digestion begin? Does anybody know? It actually starts in the mouth. Yep, it starts in your mouth. Because your saliva actually produces what? It produces enzymes. So, you know, when you smell something really good, like maybe on Thanksgiving, and you're kind of salivating, it's your body already getting ready to like start digesting the food. So it starts in your mouth, and then carbohydrates are broken down into sugar. So what are some examples of carbohydrates? Bread. Is that a carb? Have you guys ever seen Mean Girls? Yeah. And what does she say? She's like, is butter a carb? It's not, right? It's like breads, fruits. So carbs are basically just sugar. So anything that's sweet has carbs in it, but also there's some kind of like some foods that aren't really sweet that have some hidden sugars in them too. But anyway, your body starts breaking it down, so you either have complex carbs or simple carbs. And complex carbs are generally better, we say, because it takes a longer time for the body to break them down, so you don't get this huge rush of sugar going into your blood right away. So your system isn't overwhelmed, which is better. But so this is kind of a complex picture, and we'll go through it. So by the end, you should be able to understand all of this. But basically the two main organs that I want you to remember when we're thinking of diabetes are, do you guys already know? The two like main liver, or I just gave you an answer. The two main organs that we're focusing on when we're talking about diabetes are the endocrine system. Yep, I said liver, and then there's another one, and it's right up here if you want to look. It's the pancreas. So do you guys know what the pancreas excretes? What do people have to give themselves if they have diabetes? Insulin. So they're giving themselves insulin because their own pancreas isn't making enough of it or isn't making it at all. So that's one thing you want to remember, and then the liver as well. So when your sugars get broken down, they go through your bloodstream, and if things are working well and properly, it'll go into your liver, and what we call it is glucose, which is then turned into glycogen in your liver where it's stored. So your liver you can think of as kind of like a warehouse where your excess sugar gets stored in case you ever need it. So this was like probably something that our ancestors more had to deal with. If they had to go a long period of time without food or something like that, these stores in the liver could be broken down and used for energy. So that was all kind of, this is the liver, so that was all happening here. So the pancreas and the liver talk to each other a lot when it comes to sugar. So we already said your pancreas has insulin, but it also has a hormone called glucagon. So when your blood sugar is low, like we're saying, with our ancestors, if they're hunting and gathering and they're having like a rough winter and they need to go for a little while without eating, the pancreas is going to excrete glucagon. And that's going to go through the blood into the liver. And what that does is that breaks down those glycogen stores of sugar, releases that sugar into our blood so it can be used for energy. So it's very complicated, but we'll keep going through it and you'll get it by the end of this. So sugar is not bad necessarily. It's just bad in excess, right? So sugar is the energy to all of our cells. So remember when we were talking about blood pressure? We talked a lot about what getting into our cells that we needed. Oxygen, does that sound familiar? Getting the blood pumped up to our brain and out to our organs so that they could be perfused with oxygen that we need. Well, the blood is also doing an exchange with sugar. So at the capillary levels, like we talked about before, they're exchanging oxygen and nutrients. So that's where it gets exchanged, and that's a good thing. So every single cell needs sugar. And have you guys ever had it where you have gone a little while without eating or something, and then how do you feel? Do you start to feel like sleepy, confused, tired? Yeah, tired. So like you can actually feel the effects of your cells kind of needing more sugar. If you're feeling kind of groggy, maybe not feeling so well, you didn't have breakfast, then when you have lunch, you might feel better afterwards because you're kind of rejuvenating your cells. Obviously, your brain is using sugar right now, so we can learn about the diabetes, right? And so like we said, that if you don't remember anything else, the two organs that you want to think of when you're thinking of diabetes are the liver and the pancreas. So have you guys ever seen a picture of pancreas before? It's very strange looking, but that's it. This is this is the stomach, and this is the duodenum, and this is the pancreas right here. So it's really kind of connected to all of that other stuff, but it's so important. It's at the bottom there, but it secretes insulin. So the way that I learned it, and I like to tell other people to learn it, is to think of the cell, like whether it's a brain cell or a skin cell or something. Think of it as like a nightclub, okay? And there's a bouncer outside the front, and it needs to bring in sugar to get energy. But the bouncer won't let the sugar in without its friend insulin. So it's kind of like it absolutely needs insulin to get into your cell, or else it's just going to be floating around in your bloodstream, right? Does that make sense? So insulin, when it's secreted from the pancreas, goes into your bloodstream, partners up with sugar, and then hopefully moves it into the cell. But if you're getting more sugar than you need, there's going to be an imbalance of insulin and sugar. So your pancreas is going to have to work harder to pump more insulin into your blood, and eventually that's when people get type 2 diabetes, because their pancreas just gets so tired of pumping that extra insulin that eventually you need help. Your body needs help. Okay, so it makes sense then that insulin lowers blood sugar, right? Does that make sense? Why again? Yeah, it's a balance. They need to partner up together in order to move into the cell. So if you're moving the sugar into the cell, it's moving out of where? The blood. So think of it this way: if you have a family member who has diabetes, they want to learn about diabetes, I think.
Oh,
But so if you have a family member and they take their blood sugar and they see it's high, what do they do? What does your dad do? Do you know?
When it's high, he just he's on medication
Okay.
all the time.
Yeah.
So whenever he just checks his high, he just makes sure that he don't let the amount of sugar he needs.
Okay. good. Or some people that are insulin dependent, he's probably not on insulin, but people that are insulin dependent might give themselves an injection of insulin so that that can go into their bloodstream, pick up the partners, the sugar, from the blood to lower the blood sugar. So then after they give themselves insulin, they'll probably wait like 20 minutes, recheck their blood sugar, and it'll be lower. So is that clear to everybody? Why it's lower in the bloodstream? So where is it going? Into the cell. Yeah. So the cell is there, it's the nightclub, the bouncer's out front, sugar shows up, and there's no insulin around. So the bodyguard is like, you can't come in, you don't have your buddy insulin with you. So then you give an injection of insulin, it comes into the bloodstream, shows up at the cell, the two can go into the cell together, okay? I know it's a weird example, but sometimes you have to do this so that you remember things, right? Okay, so the pancreas also secretes that hormone called glucagon. Why does it do that again? Think about our ancestors. If they had those stored sugar reserves in their liver, and they needed it for when they weren't going to get food for a while, the glucagon would come into the liver from the pancreas, break up those stores, send that blood sugar, or send the sugar into the blood, and then where does it go? So it's always going to hopefully go to the cell from the bloodstream. Are you guys getting this, or is this confusing? Is it confusing?
I'm just zoning in and out.
That's okay. Did you get enough blood sugar? Or
Sorry.
enough
I haven't
a
been
lunch to
getting-
raise your blood sugar enough? Okay. Yeah, so we'll keep going over it. So this, like I said, it tells the liver to release the stored glucose in there. So it goes into the warehouse. It's like, we need the stored glucose until we can like eat something again. So that gets released into the bloodstream, that sugar, and then it can move into the cells and give the cells the energy that they need. Okay, so does it make sense that that then raises your blood sugar? So if your blood sugar is too low, your body kind of looks out for itself, goes into the liver, gets the stored stuff, puts it into the bloodstream, then the blood sugar is going to go up, right? Makes sense. So this right here is the normal body process. So it looks complex, but this is a really good picture, because this kind of tells us what happens if you either have high blood sugar or you have low blood sugar. And this is in a normal body. So this is not somebody with diabetes, because this whole process is kind of messed up in somebody that has diabetes, okay? But basically, after we eat, our blood sugar increases because we've broken down the carbohydrates in our mouth. It starts there. Then it goes through your whole digestive tract. So you get the sugar in your blood. The brain tells the pancreas what? What does it need to release to partner up with the sugar?
Insulin?
The insulin, yeah. So when you're high blood sugar, the signal gets to the pancreas, it secretes the insulin. The insulin goes where? Just into your bloodstream, partners up with the sugar. Then you're right, goes to the cells everywhere throughout your entire body. This says tissue cells. Tissue just means, it could mean your skin, brain cells, all of your organs. And then why again do we need the sugar in our cells?
So that we can,
That's okay. I appreciate your participation. We need some more participation. So basically, sugar is like the coal powering your engine, okay? So you need the sugar to power your cells. That's where they're getting their power from. Without it, they're not gonna, like, for example, I've had a patient before who had really low blood sugar, and they actually show signs of it. They're confused, they're acting goofy, they're not really walking steadily, and that's just because the power isn't, or the energy isn't getting to their cells, so they're just kind of, you can see like they're acting goofy if their blood sugar is really low. Okay, so also, if we have low blood sugar, so if we have low blood sugar, first of all, what are you thinking? Where am I going to go to get some stored sugar? Remember where we store it? Yep, you got it, the liver. So if I know that I've got low blood sugar, my pancreas, my brain tells my pancreas low blood sugar, so it's going to release what hormone? Is it going to release insulin? No, it's not necessary because it doesn't need, there's not sugar floating around in my blood that needs insulin to get into the cell, right? There's not enough sugar in my blood anyway, so putting insulin in there will actually make the problem worse. So that's not what it's going to secrete. So what is it going to be? The answer is right here. Glucagon. So glucagon goes to the big warehouse, the liver, where all of the stored sugar is. We call stored sugar glycogen. I know it gets confusing between glucagon, glycogen, and stuff. As long as you remember that glycogen is just the stored sugar, that's fine. But so this hormone goes in here, breaks up the stored sugar, releases it where? Yep, to the blood, so that we can get what? Energy to where? To the cells, to all the cells of your entire body. Yeah, you got it. You guys, is this starting to sink in a little bit? Okay, cool. All right, so we talked about this a little bit already, but there are two main kinds of diabetes, right? This is kind of hard to read, sorry, but like you said, there's type 1 and type 2. Does anybody know anybody with type 1? Okay. Does anybody know anybody with type 2? Before, a lot of us were raising our hands saying we know somebody with diabetes in our family. Do you just not know which one it is? I mean, sometimes we don't know, but usually what we notice is that if you get it later in life, it's probably type 2 diabetes because it's acquired. It's something that's come about from lifestyle, most likely, and it can be prevented. Type 1, we usually find out somebody has type 1 diabetes when they're in their teenage years. And do you know why that is? It's kind of crazy, but have you heard of autoimmune disorders? Autoimmune, do you know what it means, autoimmune? Yeah, so auto is ourself. So it actually, the immune system attacks self, which is crazy to think about. But so if you have an autoimmune disorder, which is causing diabetes, that means that your own immune system is attacking your pancreas. So what that does is it destroys the beta cells that create the insulin. So what's going to be their problem? If they have high blood sugar, their pancreas can't make insulin, right? So then if there's no insulin to bring them to the club, the cell, they can't get in, right? So they basically just have all of the sugar in their blood causing all this damage system-wide, and they'll be really, really, really sick. And so they'll usually come into the ER and find out that they have type 1 diabetes because they're not making insulin really at all. Type 2, on the other hand, which is, it used to be called adult onset, but now we're seeing more really young people that can also have type 2 diabetes. It occurs when the cells become resistant to the insulin. So I kind of touched on it before, but like when I was riding over here today on the bus, the driver had like a double gulp. Have you guys seen those? And it was with all this pop, and I just wonder like how much sugar is actually in there. So if you overload your body with sugar, and your pancreas is pumping what all the time? Insulin, to pair up with all the sugar in our blood. If it's doing that all the time, we're going to wear it out, right? We live a pretty long time, and so it can't keep up with that kind of behavior for a long time. So it'll get tired, and it will maybe not produce enough insulin anymore, or your cells will get so tired of, sugar, insulin coming in all the time that it will actually become resistant to the insulin. It'll say, like, no more, we have too much. So both of these are issues. Type 1, pretty much, they're always going to be dependent. They need insulin, because why? They're not making it, really, because they have that autoimmune thing where their pancreas has been damaged to the point where it doesn't even make the insulin anymore. So they absolutely need to either have an insulin pump. You guys ever seen that? Basically, they'll implant a pump that has insulin in it, and the pump will go off on its own just because they're so dependent on it that they need a kind of a regular dose of insulin all the time. Other people will carry their syringes around, if you've ever seen that, and they will actually give themselves injections throughout the day, usually after they eat or something like that. Type 2, you can go on medication and maybe not need insulin yet, or some people actually modify their lifestyle so effectively that they don't need medication at all. However, if you are ever diagnosed with diabetes, you have it for the rest of your life. It is not reversible, okay? So sometimes people think, I used to have diabetes, but I changed my life and I'm healthy and I'm not having any damage or anything like that, and I don't need to take medication. Well, that's really good, and I'm glad they made those changes, but they still have diabetes. Okay? Any questions about which one is which? All right, so do you guys know the signs and symptoms of type 1? Okay. So typically for type 1, we go by the 3 Ps, okay? And you can kind of get a clue from the pictures. But the first one is polyuria, okay? So poly means what? Many, a lot. Urea, urine. So that, of course, is increased urination. We'll talk about why. Polydipsia, do you know what that is? Poly, again, is many or a lot. Dipsia actually means thirst, like drinking a lot of. So they'll actually drink so much water because they're just thirsty all the time. And then the last one, polyphagia. So again, poly means a lot, and phagia means eating. So I like to remember it. Polyphagia sounds like feed. Polydipsia, dipsia sounds like drink with the D. But does anybody have any guesses as to why each of these symptoms arise? How come you would feel more hungry if you actually have too much sugar in your bloodstream? Why would you feel hungry? Because if you don't have insulin, because this is type 1, so they don't have insulin, so is that sugar getting into the cell to give the cell energy? No. So the cells are essentially starving, even though you have all of this sugar on board in the bloodstream. So it kind of makes sense, right, that you would feel like your brain thinks that you're starving because really you're not getting any nutrients into your cells. Because again, who do we need to get into the cell? If it's the nightclub and sugar shows up and he's like, please let me in, and they're like, you can't get in without your buddy insulin. So you need insulin. So if you don't have it, you're not going to get the energy in your cell. What about the increased urination? What do your kidneys do? they're supposed to clean your blood, right? They filter your blood. And then the waste product from your blood is what? It's urine. So, so if you have all of this extra sugar, your kidneys are kind of freaking out, and they're like, I can't even purify this blood because there's so much sugar. So they'll keep working and working and working to get the sugar out. So people that have type 1 diabetes and it's not being treated, if you test their urine, it has a ton of sugar in it because they're just peeing out all of this fluid with sugar. So, and if you're peeing all the time, what happens? You're thirsty because you're dehydrated. So it's just this vicious cycle. So you can see that it affects all these different things. You know, insulin is so important to have. How about type 2? It looks like there's some more symptoms. But actually, it still has frequent urination, which is which one? Yeah, perfect. Polyuria. So remember the 3 Ps. So what about this one? He's always hungry. Yeah, she knows. Say it. Yep, polyphagia. Perfect. And then the last one is my favorite one. It's the most fun to say. Polydipsia. Perfect. And then, of course, they even have more. So have you ever heard of people with diabetes, they have wounds that won't heal? Wounds that won't.
At the nursing home, they would tell us to make sure to check their records before we shave them every day.
Yeah.
To make sure they don't have diabetes.
Yes. And why would that be?
Because if we cut them, there's a possibility that they're really not.
Perfect. Yeah, that's a perfect example. So why is it actually, what's the underlying reason why their little cuts and stuff won't heal?
Because they have
Their vasculature is kind of crappy, isn't it? Because if you think about it, there's all this sugar inside of the bloodstream, and what do we say the sugar is like?
little crystals that are just damaged.
Little like crystals or shards of glass, and it's passing throughout your entire body. So over time, it starts cutting up those vessels. They become leaky, or it causes, we'll get into it, but it causes like hypertension or high blood pressure. And so all of this damage to their vasculature makes it so that they can't actually deliver the white blood cells to get to the site that's cut, right? So what do the white blood cells do? They're our immune system, guys. So they fight infection, or they fight little like microbes that get in through cuts and stuff like that. So what do you think happens if they don't have that first defense in their skin? They don't have that first line of defense where the white blood cells are going to get the infection out, the blood cells are going to clot up, and then this is going to have a scab and eventually heal. It just stays open, right? And so what can get in there? Disease, infection, yeah. So they'll have that, wounds that don't heal, which is a big problem, we'll see. Sudden weight loss, why would that be? Same idea with if the sugar or the energy can't get into the cells, it's just in the bloodstream, right? We already said all they're doing is peeing it out. So that sugar actually doesn't really get taken in anywhere. It's just being wasted. So they'll lose a lot of weight. And then what about numbness and tingling in hands and feet? Yeah. My dad has it's called neuropathy. And so they'll actually have numbness or tingling in their feet. So they can possibly even not know that they've gotten a cut on the bottom of their foot because they can't feel it, which is a huge problem because we already know that's a huge infection risk, right? Because we were talking about with the nursing home and shaving people, you don't want to shave people if they have diabetes with a regular razor because you could cut them. So same thing on the bottom of the foot, that vasculature isn't so good. they have nerve problems, so they have numbness down there. They're not going to know that there's a cut, so that's really dangerous. And we'll get into that. And then also blurry vision. Why would that be? Same idea. Just remember, it's that sugar is like little shards of glass, right? Going through all of your vasculature. So what about, do you have veins in your eyes?
Yes.
Vessels in your eyes? Yep. So it's going to cut those little vessels back behind your eye, and blood will actually leak, and it can cause blindness.
So if the blood was to leak, would your eyes show like some kind of redness? Or?
No, you cannot see it on the outside. Like, I used to work for an ophthalmologist, and so he would look with a little instrument actually through the pupil, and that's the inside of your eye. So he would look in there, and you could see little hemorrhages, little places where blood had leaked inside of there, but you won't see it on the outside. And they can never really fix that. So it causes blindness. And then this also says sexual problems and vaginal infections. And the vaginal infections thing is actually because there's so much sugar throughout the body, and what likes sugar? Bacteria love sugar. So it can cause infections and things like that too. So for screening, have you guys screened for it at all before? You have?
I have.
Okay, it's cool. Do you know do you remember the range, the normal range?
90 to 120.
Yeah, so it can be different with different institutions. So Rush's is like 69 to 99. The American Diabetes Association says 70 to 130. So it'll vary depending on what institution you're going by. And also, of course, it's higher after meals, right? Why would that be?
Your body's digesting.
Yep. You're breaking down those carbs that you might have just eaten. It's still in your blood sugar. Hasn't gotten a chance to, for everybody. If I get my blood sugar tested after I eat, it's going to be higher, and then about a half hour after I've eaten, it's going to go back down to its normal range. And that's just because you got to give your pancreas time to work and get the insulin into your bloodstream to take the sugar into the cell to use for energy. What about hemoglobin A1C? Has anybody heard of it? So for example, if you were screening somebody and say they had a blood glucose level of like 250, you might want to say, you definitely want to say, I'm concerned you could possibly have diabetes or something, so I would like for you to go and see either your doctor or your nurse practitioner, and then they'd probably do a hemoglobin A1C, which is just, it's an average of their blood sugar. So at any point in time, you could take somebody's blood glucose level, and it might be pretty high, but then that's not their normal. So you've kind of caught them at like a time when it's just higher than it normally is. But for hemoglobin A1C, it's going to tell you consistently what it usually is over a 2 to 3 month span of time. And they do that, they take blood, and they do that in the doctor's office. So for that, it's given in a percentage, so it should be 7% or lower. And I've actually had patients who have had hemoglobin A1Cs that have been like 12, 14%, which is double what it should be. And those people likely already have damage, which we'll get into. Of course, family history. So if you have family members, which most of us, I think, raised our hands that we do, that have diabetes, either type 1 or type 2, you're at a higher risk. Okay. And then risk factors are being overweight, not exercising, and then the family history as well. So we'll talk about prevention. But here is a nice looking blood vessel, right? Looks really good? No, that looks terrible. So it's really interesting because how we learned hypertension, it's super related to diabetes. Why do you think that is? I mean, look at all of that damage in there. So if this is the only space that I have for my blood to pass through, what is my heart going to do to compensate to get it where it needs to go? It's going to be pumping harder, and we know if it's pumping harder, what's happening? Our blood pressure is up, right? So the blood pressure is going to go up. And also, it kind of reminds me of hypertension too, but with stroke, what about that? Why are you at risk for stroke?
Because it can cut off the oxygen to your brain.
Well, it could if that's what your vessels look like. If they're clogged, you could get an ischemic stroke where you're not getting oxygen up to your brain. Or on the other hand, remember, what are the little crystals of sugar doing? Cutting the vessels. So that's going to happen in your brain. I mean, we already said it could happen in your eyes, so obviously it's in your brain too. And it can cause them to leak and cause a hemorrhagic stroke or bleeding in your brain. All right, so let's review. So what complications can we get? We can get blindness, stroke,
High blood pressure.
heart attack because of the high blood pressure. Yep. What else? What about if your cut never heals on the bottom of your foot? Infection, which could, and if it never heals, what's going to happen? Have you ever seen, necrosis, which then leads to, and then what do they do? Amputate, So, so amputation. So I've taken care of a good amount of people that have had amputations because I work on a neurosurgical and cardiovascular and thoracic surgery floor. So what did we say? They can get, I gave away one, but they can get a stroke. So I see those kinds of patients that are recovering from a stroke. They've had surgery to get the leaky blood out of there. They've had cardiovascular issues because of the high blood pressure, the clogged arteries and things like that, or the damaged vessels.